Which of the following findings is most likely to be seen in this patient? 65-year-old man presents to his PCP with a 3-month history of exertional dyspnea and fatigue, so he's been dealing with this for a while. Past medical history of hypertension controlled with medication. On physical examination, the physician notes a prominent apical impulse, harsh systolic murmur, best heard at the second intercostal space, radius to carotid arteries. ECG shows left ventricular hypertrophy. So reveals reduced aortic valve area, increased pressure gradient across the valve. Okay. Which of the following findings is more likely to be seen in this patient? So dealing with exertional dyspnea and fatigue, sounds like he's having maybe stable angina. Harsh, so prominent apical impulse and harsh systolic murmur, best heard at right second intercostal space, radiates to carotid arteries. That sounds like a aortic stenosis.
Okay. Okay.
ECG shows left ventricular hypertrophy, which makes sense because of the increased pressures. Left ventricular wood, left ventricle wood hypertrophy, reduce aortic valve area. Yeah, okay, so reduce aortic valve area, so stenosis there. And then which the one was penis patient bounding pulses, diastolic decrescendo murmur, no pulses paradoxus, pulses parvus et tardis, and wide pulse pressure. Ooh, okay. Wide pulse pressure means the difference between systolic and diastolic is the gap is bigger. It's not the diastolic decrescendo murmur. Aortic stenosis is a crescendo decrescendo. Bounding pulses, I don't exactly remember what that means. I don't remember what pulses. Paradoxus is like opposite pulses, I guess. I don't really remember what that means either. Pulsus parvus et tardis. Um, don't know. I'm thinking wide pulse pressure. Wait, I mean, that's the only one I kind of feel comfortable with. I don't really know the other ones.
Okay. Final answer.
Yeah.
Okay, let's figure this out here. I couldn't remember actually. Let's see. Widen pulse pressure is aortic regurgitation, not stenosis. That's what it was. I knew it was one of the aortics, but I forgot in my head. Parvus, pulsus parvus altardis. Right. We already know that it's gonna be aortic stenosis. So you got the diagnosis. Great. Okay. Pulsus parvus altardis is a characteristic finding which refers to weak and delayed carotid pulse due to obstruction of blood flow across the stenotic aortic valve. So that's just something you have to add, right? It's not bad that you missed the question because you already have almost 99% of it. So you just add this. Bounding pulses usually seen with aortic regurg, not aortic stenosis. So remember, put that into aortic regurg basket along with wide pulse pressure. Pulsus paradoxus is usually in cardiac tamponade and severe asthma. They do ask that, so make sure you remember that. Diastolic decrescendo murmur is also aortic regurgitation. So this one's a little bit tricky, right? Because it's not often that we see pulsus parvus at tardis, right? So this is going to be aortic stenosis, right? This is aortic regurg, right? Aortic regurg, and then pulsus parvus is like severe asthma versus cardiac tamponade. But I think you hit it right on the nail that this is definitely for sure, right? Aortic stenosis. So I think you worked through it and got the diagnosis great. You just have to add something specific to it, is all.